Finally, let's welcome Michelle Sumrall and Mary Wayne of Cardiopulmonary Services at Novant Health Brunswick Medical Center. Michelle, Mary, thank you so much for coming to our show today.
Thanks for having us.
It's great. And I want to start first by learning a little bit about each of you. I know that you've been on the show several times, Michelle. So let's start with you, and you tell us about your role at the hospital.
Okay, well, my name is Michelle Sumrall. I am the manager of respiratory care services at Novant Health Brunswick Medical Center. In that role, I also run the cardiovascular diagnostics department as well as the cardiac rehab department.
Awesome. And tell us a little bit about your background. How do you get to be a respiratory therapist?
Well, a lot of respiratory therapists start out with an associate's degree, which is the case for myself. I began at a community college, got my associate's degree, went back for my bachelor's, and I just recently finished my master's degree at UNC Pembroke.
That's awesome.
Yep.
Yeah, that's exciting. So Mary, tell us about your role at Novant Health Brunswick Medical Center.
My role is I am the pulmonary function technologist in their pulmonary function lab, so I do breathing tests Monday through Friday. I'm also a registered respiratory therapist. I've been a therapist for 30 years. I also started with an associate's degree from a community college. I'm originally from Cleveland, Ohio, and I'm working on my bachelor's degree now through UNC Charlotte.
Nice. Well, that's great information. How did you get to the beach? How did you get to here from?
My family vacationed at Hilton Head since I was 13 years old, and it was always my goal to be back here, be back south. I love the south.
Yeah.
Cleveland doesn't do much for my breathing in the winter. I am a childhood asthmatic, and that's what led me into respiratory therapy.
Well, that's interesting. Yeah. Well, today I want to learn more about pulmonary function testing. Right. I think it's referred to as a PFT.
Right.
We hear that phrase a lot. So can you describe for me what pulmonary function testing is?
Pulmonary function testing is a series of breathing tests, and it tests different areas in the lungs. We use it for diagnostic purposes to see if there is pulmonary disease. We can use it preoperatively to see if somebody can withstand anesthesia. We use it to assess any kind of respiratory treatment that the patient might be receiving to see if it's working, and we can also stage pulmonary disease with the pulmonary function testing. We do full pulmonary function testing at Novant Brunswick, and that entails of 3 tests. There's spirometry, DLCO testing, and lung volumes. So spirometry is testing that really checks the condition of your airways, and diseases like asthma and emphysema will show up on that. They are known by their the spasticity of the bronchial tubes and the swelling, and so those people have trouble getting air in and out, and that's what that testing shows. The DLCO testing is a lung diffusion test, and what that checks for is to see how well your lungs are putting oxygen into the blood. And there are diseases that will interfere with that process. It's the air sacs in the lungs where the oxygen goes across the membrane and into the blood. And anything that blocks that could be mucus, fluid, could be scar tissue from industrial exposure or smoking. And then also the other test that we do is a lung volume test, and that kind of checks to see how much air is left in the lung when somebody blows all the way out. When you empty your lungs, they aren't always empty. There is a little air in there that keeps the alveoli or your air sacs open. The problem with air trapping is that people who lose elastic in their lungs, we all lose elastic. We lose it in our skin just as much as we lose it in our air sacs in our lungs. But that process is, it's made faster by things like smoking and industrial exposure. And so when you lose that elastic in your lungs, the elastic doesn't work well to shrink back down to the small size of the alveoli to get that air out. And so what happens is it's like an overblown balloon that never shrinks to its original shape. So there's air trapped in there that's stale and old. It's full of carbon dioxide that needs to come out so that fresh oxygen can come in. And so we look for that.
Well, are there, when would you consider having tests like these? What might cause that?
An unexplained cough and shortness of breath. Sometimes coughs go on for a long time, and it It might not be a virus or bacteria.
Okay.
It might be a pulmonary disease. And also shortness of breath. People think that they're going to get short of breath as a normal sign of aging, and it's not a normal sign of aging. If you feel short of breath, you should bring it up to your doctor. And the problem with shortness of breath is that it can be a vague symptom. It can mimic other things such as heart disease or kidney disease. And so you really want to rule out, is it the lungs or isn't it?
Well, can you explain to me a little bit about what a patient might expect? What do these tests feel like, look like the setup at the hospital? How does that work?
So we do the testing in a little booth. It's a glass booth. We call it a body box or a body plethysmograph. And it looks like a phone booth. Most of my patients ask me when the money's going to start flying so they can make a grab for it. But we only shut the door for one test. And there are patients who feel a little bit claustrophobic, but I sit right in front of the door, which has a full glass view so they can see me.
Right.
We don't cut off air or oxygen. I speak through a microphone and a speaker. But it's just a series of breathing drills. We may have somebody take a deep breath in fast and blow it out as hard and fast as they can, as long as they can.
So it's all normal stuff. It doesn't hurt.
It's a maximal effort test. So people feel nervous coming in because they feel short of breath to begin with. And I tell them,
I see what you're saying.
I tell them, don't be nervous. We can get through this.
Yeah.
We can take our time. We can take a break and rest in between efforts if you need to. There is a test that involves a breath hold for a short 6 seconds, and there's a test that involves panting against a closed valve. It feels like you can't get any air, but it goes very quickly, and most of my patients do very well, even if they're short of breath. I usually explain every test to them thoroughly, and then I coach them through. So I'm kind of like a coach and a cheerleader.
How about insurance? Are these typically covered by insurance? Michelle, can you help me with that?
So what we recommend is that for certain disease processes, they are usually covered by insurance and Medicare. But we always tell patients to reach out to their insurance provider and call them to make sure that it is going to be covered by their insurance prior to coming in.
Do these tests require a physician order?
They do require a physician order, but it doesn't have to be a pulmonologist. A primary care physician can order these tests. All of our tests at Novant are interpreted by a pulmonologist. So even if they are not consulting pulmonary, they will have a pulmonary assessment of the exam.
So if we have viewers at home watching and they believe that one of these tests might be appropriate for them, what would you recommend they do?
I would recommend they speak to their physician. Their primary care physician is a good place to start. Then they can make the decision whether they want to send the patient to a pulmonologist or not. But the test can be done before pulmonologist even sees the patient. And it's nice for them to have that test in their hands. So it's good to get a jump on it. And I recommend they don't wait until their shortness of breath is so severe that they're near the end stages of lung disease. Or perhaps it's a cardiac condition and you need to get that checked out pretty quickly.
Right, yeah. Well, this has been great information, but Michelle, is there something we've missed?
I don't think so. Mary did a great job at explaining everything.
She did a great job, because that's a tough subject.
Yeah, explaining, without going into the nuances of each different study, but explain what they're for, how that patients can get their providers to order it, and who to start with. So I think that she did a very great job explaining all that.
Yeah. So if there's any patients out there or viewers that have questions, is there someone they can reach out to?
So we always recommend that they reach out to their primary care provider
Sure.
if they have questions, but it is
If the primary care has suggested that this would be a good idea, then if they had more questions, can they call somebody at the hospital?
Absolutely. My office is always open and my phone is always on, so they can certainly call my office and we can point them in the right direction, as well as Mary's PFT office. She's always
that'd be great.
there to
Right, they
answer.
can call and I can answer questions about the test, especially if they're feeling nervous. My biggest thing is don't be nervous because I can help you get through it. Yeah.
Well, thank you both so much for being here today. It's been a pleasure meeting you, Mary.
You too.
And I know Michelle's been on our show before, and I look forward to having you guys back. There's some great topics there to explore a little more. So thanks so much for coming.
Thank you.
Absolutely. Thank you for having us.
You're welcome.